Learn to answer next-gen NCLEX cases from expert test masters only here at GRA.
Okay. A client of childbearing age visited her primary physician reporting the possibility of being pregnant. Client presents to the OB clinic with complaints of pregnancy. Client reports feeling nauseous and episodes of vomiting in the morning. Okay. Client also complains of breast tenderness and enlargement. Client's last menstrual period was 2 weeks ago. Physician orders for urine pregnancy test. The test result is positive. Physician assessment reveals there is an increased size of the client's abdomen. Pelvic examination indicates a positive Goodell sign and noticeable bluish discoloration of the vagina. Physician uses a Doppler device to detect fetal heart tone. The nurse determines that the weakest client finding as a potential sign of pregnancy is or are. Select all that apply. Okay, so we are talking about the weakest, weakest. Okay, remember these are the different signs of pregnancy. We have your presumptive, okay, probable, and positive. Out of the three, what is the weakest sign? Out of the three, what is the weakest sign here? Weakest sign for possible pregnancy? Presumptive, probable, or positive? Presumptive. So you are looking for presumptive signs in this. You are looking for presumptive signs here. Okay. Breast tenderness and enlargement. Presumptive, probable, positive. Presumptive. Okay, so pick letter A. LMP was 2 weeks ago. Last menstrual period. Presumptive, probable, or positive? Presumptive again. So pick letter B. Positive urine PT test. Presumptive, probable, positive? Probable. So that's not the weakest. Positive Goodell sign. Probable pa rin. So not the weakest. Bluish discoloration of the vagina. Probable pa rin. What do we call this one? When there is a change in vaginal color, because of constriction of the blood vessels, causing it to become bluish. Very good. That's what we call as your Chadwick's. Okay. Fetal heart tone. Faint fetal heart tone. Presumptive, probable, or positive? Positive. So the correct answer here is only letter A and letter B, because this is the weakest. The weakest out of all the three potential signs of pregnancy: presumptive, probable, or positive. So letter A and B ang answer. Okay, let's continue. Okay. So at January 25, a 34-year-old client, G2P1, 12 weeks AOG, visited the wellness clinic for prenatal assessment. Client has had a history of a heart attack 2 years ago. Client was also diagnosed with anorexia nervosa and generalized anxiety disorder in her late teens. During visit, the client complained of experiencing nausea and vomiting 1 to 2 times in the morning. Client also added that the client has started losing her appetite from constant vomiting. Client is beginning to get anxious that her eating disorder is possibly causing her nausea and vomiting. Okay, at February 20, so this is the current na schedule. February 20 at 0800, the client continuously complained of nausea and vomiting despite interventions recommended. Nausea and vomiting persist 3 to 4 times per week, usually in the morning. Client stated strange craving such as flour, baking soda, and detergent powder. Okay? Client was embarrassed to admit that the client has started succumbing to this craving. So the patient started eating detergent powder. Okay. Additionally, the client also started experiencing abdominal pains, change in bowel habit and consistency, and on occasion would defecate blood-stained stool. Client is insistent in seeking aid for possible anorexia nervosa relapse. Flow sheet. Okay. So from preconception, no, before the client was pregnant, this is the vital signs. Temperature is normal, pulse normal, RR normal, BP normal, pulse oximeter normal, fundal height, okay, normal, no zero, there's no problem. The weight is 53 kilograms. So take note, your patient's weight is 53 kilograms before she got pregnant. No? Okay. At January 25, okay, 12 weeks gestation. Now the temperature is normal, pulse normal, RR normal, BP 120/60, that's normal, pulse oximeter normal, fundal height 12 centimeters, so pantay siya, no? At 12 weeks gestation, 12 centimeter ang fundal height, no problem. Fetal heart rate was 159, that's good. Weight is 56 kilograms, so the patient has gained 3 kilograms. Okay? At February 20, yung current, no? Roughly after a month. Okay, at 13 weeks gestation, the temperature is still normal. Temperature normal, RR normal, BP is a little high, but take note, the blood pressure of the patient usually increases when they are pregnant. Okay, pulse oximeter is normal. The fundal height is no longer equal with the weeks of gestation. This could mean that the vomiting, the nausea, the loss of appetite has taken its toll. The fetal heart rate is 170. Okay, there is a sign of fetal distress na. Okay, and the weight is 52 kilograms. So the patient was significantly lighter than last month's assessment, no, losing over 4 kilograms. Okay. So let's answer the following. No? Complete the diagram by dragging from the choices below. 1 priority condition, 2 actions the nurse would take to address the condition, and 2 parameters the nurse would monitor for this patient. Okay, so what is your priority condition for this patient? Is it letter A, hyperemesis gravidarum, B, fetal distress, C, pica, or D, anorexia nervosa? What is your priority condition? Now, all of this can be seen in your patient. No, you have hyperemesis, fetal distress, but what is our priority? Okay, so I'm just going to wait until I get all the answers in. Okay, so very good, no? Nobody chose any answer but fetal distress. Because in OB, no, kapag OB ang question, who is your priority, the mother or the fetus? If you are dealing with an OB question, who is the priority? The fetus, correct. So whatever is the condition of the mother, we don't care. Once the fetus is affected, you pick. Letter B is the correct answer. Okay? Okay, so letter B is the correct answer. What is your priority action then? Now, knowing that the baby is in fetal distress, what would be the priority action? We need 2 priority actions. Very good. The priority action is preparing for a contraction stress test and to notify the physician immediately. Encourage to increase OFI is a treatment for hyperemesis, so that's not our answer. Collaborate with a psychotherapist is for anorexia nervosa. Perform a 24-hour diet ritual is for pica. No? And now, what should we monitor to evaluate the patient's progress? Now, what would we monitor to evaluate the patient's progress? So, ano yung pinaka-importante? What is the most important thing that we need to monitor to evaluate the progress of this patient? Okay. Number 1 would be a fetal heart rate, because you're monitoring the fetal heart rate, and the maternal weight and the BMI. Diba? The maternal weight and the BMI. Why? Remember, Now, when we were talking about weight gain and weight loss, di ba? 1 to 2 pounds of weight gain of weight loss is considered normal. Okay, yes, normal yan siya. 3 pounds, you need to assess the baby, and you need to assess the mother. Okay, 4 pounds of weight gain or weight loss, you need to perform a biophysical profile because this has a significant effect to the child. As we can see, no, from 56 kilograms to 52 kilograms after a month, no, that is a drastic change in maternal weight. No, the patient there has lost roughly about 4 pounds, which means we have to continuously monitor this one. No, this will affect the baby, no, significantly. So the correct answer is B and E. No, B and E.
Follow us for more of this and learn with confidence only at GRA.